morning. Exercise in type 2 diabetes mellitus. Exercise is an important tool in managing type 2 diabetes. It will not only achieve the targeted goal, but it also improve the quality of life in people with type 2 diabetes mellitus. There are different kinds of exercises like aerobic exercise, resistance exercise, high intensity interval training, combined exercise, which is aerobic and resistance together. Other types of exercises are yoga and tai chi. Aerobic exercise is a physical activity in which body uses oxygen and it is repetitive and rhythmic. Resistance exercise is one of the type of anaerobic exercise in which body does not use oxygen but it breaks down the glucose. Resistance exercise can be done by using body weight, by lifting weight, or by doing exercises on the weight machines. High intensity interval training is a physical activity which can be done by quick repetitive burst with maximum or near maximal effort with period of rest or by doing low impact activity between the bouts. Yoga and Tai Chi is for flexibility and for balances. So by doing all this exercise or any of these exercises, there is an improvement in glucose, lipid profile will improve, weight reduction will happen, HbA1c will reduce. In diabetic nephropathy, the level of albuminuria, tubulointerstitial fibrosis, oxidative stress, and inflammation in the kidney will reduce. And by doing aerobic exercises like walking, jogging, running, there will be increase in strength in lower limb, which will very helpful in diabetic neuropathies. Exercise will also reduce the complication of cardiovascular diseases. Now, the mechanism of exercise, how it is reducing the insulin resistance, how it is improving the insulin sensitivity, how it is increasing glucose transport and metabolism, as well as reducing inflammatory response and regulating lipid metabolism. So, exercise training sensitizes the skeletal muscle and it activates the adenosine monophosphate activated protein kinase in skeletal muscle. Also, it promotes the translocation of insulin activated glucose transporter 4. And by doing single strenuous activity, there is an activation in inflammatory factors like TNF alpha and IL-6. Also, it reduces the inflammatory markers in the entire body by doing long-term regular exercises. Exercise will accelerate the oxidation and conversion of IMTG. Thus, it will increase the intermediate lipids and reduction in the intramuscular lipids, and thus it will regulate the function of insulin to a certain extent. Exercise will increase the nitrogen oxide synthesis and bioavailability. It will reduce the oxidative stress and pro-inflammatory molecules, and thus there is an improvement in the endothelial function. SCFA is producing bacteria in the intestine. Thus, exercise will enhance the abundance of SCFA in intestine as well as in blood, and there is an improvement in the insulin resistance. Exercise will improve the glycolytic content in the skeletal muscle. It increases the glycogen in the skeletal muscle. It reduces the hexosamine pathway in the skeletal muscle, as well as it improves the glucose flux in the skeletal muscle. Aerobic exercise. So the examples of aerobic exercises are swimming, walking, jogging, running, stairs climbing, cycling. Aerobic exercise will improve insulin sensitivity. It will reduce the cardiovascular risk. It reduces the HbA1c. It will improve lipid profile, and thus there will be reduction in weight circumference. Crunches, planks, push-ups, exercises with dumbbells, exercises with therotubes are the examples of resistance exercise. Resistance exercises will improve insulin sensitivity. It will give glycemic control. Lipid profile will improve. HbA1c will reduce. So, steatotic liver is a fatty liver which can be alcoholic or non-alcoholic. Non-alcoholic fatty liver can be due to metabolic dysfunction activated fatty liver. So, a healthy liver can be achieved by doing resistance exercise as well as aerobic exercise. Resistance exercise will promote hypertrophy type 2 muscle fiber. It will increase expression of GLUT4 and AMPK. It will modulate irisin. It will inhibit fatty acid synthase and SREBP1C pathway. Hence, there is an improvement in metabolic flexibility. Aerobic exercise will activate lipolysis, it will upregulate UCP1 and PPAR, it will modulate adipocytokines, and there is an improvement in insulin sensitivity. Combined exercise, which is aerobic and resistance exercise done together. So nowadays there is a sedentary lifestyle, people are doing desk job, there is a prolonged sitting. So to interrupt the prolonged sitting, we can advise people with diabetes to just do light intensity walking or just simple resistance activities which can be done after meal, whether they are in the office or they are at the home. So after meal activity will reduce the postprandial glucose, insulin and triglyceride levels. So the simple exercise can be done like walking on place, half squats, toe raising and gluteal contraction, which can be done by sitting on the chair only. Okay, we have already seen that what are the effects of doing aerobic exercise alone and doing resistance exercise alone. But what is the effect of doing combined exercises? By doing combined exercises, there is a great control in glycemic glucose. There is a very good reduction in HbA1c, improvement in insulin sensitivity. But if HIIT is done along with the combined exercises, there is an improvement in skeletal muscle oxidative capacity, a very good glycemic control, insulin sensitivity will improve, reduction in HbA1c, and a massive body weight reduction will happen. So, as per the guidelines, aerobic exercise should be done 150 minutes per week, that is around 30 minutes a day. And resistance exercise should be done 2 or more days, that is around 2 or 3 days per week. So that is the example 1 by doing combined exercises. Moderate intensity exercise, aerobic exercise should be done 150 minutes per week, and 2 or 3 days muscle strengthening exercise should be done. But if vigorous intensity aerobic exercise is done, then it should be 75 minutes, that is around 1 hour and 15 minutes, and with that muscle strengthening exercise should be 2 or 3 days. And if a mix of moderate and vigorous intensity exercise is done, then it is like resistance exercise, which is 2 or 3 days, not more than that. And with that, muscle strengthening activities should be done 2 or 3 days. Yeah, thank you. Also, I want to give demonstration of the combined exercises right now, and it will not take a time. So requesting you all to please stand up. I know everyone is fresh right now, but still. Okay. So first we will do walking on place. Start. Please, everyone walk on place by moving their hands. Yeah. Okay. Now we will progress it to marching on place. Your knees should up. Yes, up to the waistline. Thank you. Your hand should be moving. Now, your fingers should be locked. And please come in front of the chair. Chair के आगे आना है आपको. We will do sit to stand exercise. Like partial squatting we will do. Okay, now you have to sit down. Okay, now you have to sit down, but your butt should not touch the chair. It should be somewhat off. Yeah, it's partial squatting. 1, 2, 3, 4, and 5. So this is the example of combined exercises, which is aerobic and resistance exercise. Thank you so much.